Any exam topper score is standard, doctor, let me tell you. Out of 200 questions, 120 out of 120 without a single mistake topper will do. Toppers have got at least a reasonable common sense. Second character. So out of 40 questions, at least 30 questions he will do. Kitna ho gaya? 150. Then luck factor is same for topper or a pauper. God doesn't know anybody, has no inclination for anybody. So out of the lottery questions, 50% everybody will get correct. General rule. So wahan 20, 170, 165, 155, 160 to 170 any entrance, 80 to 85%. Even in our mock tests also, every Sunday that we conduct, the moment you get 75% score, you are done. You reached that academic orgasm. Beyond it, there is nothing left. You already have reached that pinnacle. Okay, but you need to be quite sure to reach that score. What will happen after photodynamic therapy? I was not sure what will happen, because either you will become pale or you become erythematous. Only two things happen after photodynamic therapy. Neither of those two things were given here. I don't know what examiner want to know. Erythrodermic psoriasis. How does it differ? Treatment differs from that of the regular plaque psoriasis. Steroids are never given in erythrodermic psoriasis, because the moment you stop steroid, there is a resurgence and worsening of the lesions. Coal tar is not given in case of erythrodermic psoriasis. It also will exacerbate and worsen it. So that is the reason methotrexate is the one which is still given in erythrodermic psoriasis. Methotrexate, cyclosporin, oral retinoid, or a biological like infliximab is the one which is basically administered. What is the type of urticaria where on exposure to sun, exertion, emotion, anger, eating hot food or becoming hot, anything can lead to urticaria? Means classical of a cholinergic urticaria, classical clinical vignette. Whenever cholinergic urticaria is there, multiple bumps like this will appear, small like pimples. You get multiple pimples like thing in cholinergic urticaria. This is a beautiful question, doctor. Regularly it is asked. Without a question on leprosy, there is no paper. Okay? If you take the high yield topic list given to you, dermatology you check, leprosy is high yield, psoriasis is high yield. 5 out of 5 you can get if you read top 10 topics in that list. We might have given some 20 topics in dermatology in the topic list. If you don't get time, at least top 10, read thoroughly and go and pray God. You will definitely get it. Huh? See, doctor, hypoaesthetic patch with ulnar and popliteal nerve thickening is there. When do you call tuberculoid? Single lesion, single thick nerve, thickening of single nerve thickened. Borderline tuberculoid, classically satellite lesions will be found. Main lesion के आजू बाजू में satellite. Few non-symmetrical nerve thickenings will be there. BB, how will you identify? Punched out lesions, Swiss cheese lesions. If BB is there, you will get a, what is BB? Bread and breakfast. If you go for honeymoon to Switzerland, you are offered a bed and breakfast accommodation and get Swiss cheese. So easy to remember. What is the difference between Swiss cheese and Indian cheese, which Lord Krishna used to eat? What is Swiss cheese? Cheese is cheese only, no? Cheese with perforations is Swiss cheese. Lord Krishna, which Yashoda used to make him eat, is solid cheese without any this thing. In the Switzerland, in the mountains where goat is giving milk and cheese is prepared, that will have perforations. That is the Swiss cheese. Endometrium we call Swiss cheese pattern. What is the meaning of it? Perforated appearance of cheese. Then inner border of lesions is well defined, outer border is ill defined, that you call BB. What is BL? Multiple lesions, symmetrical with multiple thickened nerves. Then you call BL. That's what is given in the exam. Then what is LL? Every time the same thing they will give. Multiple lesions, perfectly symmetrical, glove stocking anesthesia. Histologically, Grenz zone will be found. Onion peel appearance if you do a nerve biopsy. But normal sensation of the patches is an important feature. In case of lepromatous, earlobe infiltration, trophic ulcers will be found. So every exam you go, they give some features of this and ask you to identify which type of leprosy it is. 45-year-old, hypoaesthetic, large block, elevated margins on the trunk and ulnar popliteal nerves are enlarged. What is your diagnosis means? Multiple nerves with multiple lesions, BL. Patient comes with few hypopigmented patches, his ulnar nerve on left side and lateral popliteal on right are enlarged. Classical example of BT, like that. So I leave the literature for you. So what you will not ask in psychiatric history? Occupation you ask, education you will ask. Why will you ask about diet? You will ask. Anorexia nervosa you may ask. I don't know what examiner don't want to ask. Fourth option, anybody remember? Huh? Marital status. शादी हुआ या नहीं हुआ या नहीं तो वो छोड़ के गया या आप छोड़ के गए. In fact, all of them are important in the history. I don't know. Maybe some examiner has some point which our brains are unable to catch. Obsession. What is not correct? Schizophrenics can have obsession, and obsession is that intruding thought which brings anxiety. Compulsion is a motor activity which will bring down that anxiety. That's how it makes obsessive compulsive. What is ego? Dystonic and symptotic. Symptotic means patients will feel that they have something, a very abnormal habit, but they won't feel that abnormal habit as abnormal. That fits very well with the idealistic self-image that they have. For example, doctor, you joined army. Army means discipline. You joined PHC. PHC means only indiscipline. If you go there and talk about rules, all your PHC staff will identify one nice bomb under your car. The moment you start, it will blow. So you can't be a hero suddenly talking rules in a PHC. The way he will tell, Nurse Mary will come on Monday, lab technician on Tuesday, you come on Wednesday, doctor, and don't ask all of us should come on same day. Except when DMNHO comes. And already we told DMNHO when to come. So there is no anxiety. But if you go to the army and talk like that, your senior colonel or major will hang you. Right? So ego, symptotic and dystotic are the two things. You go to a serial murderer, anytime as a doctor have you gone to treat the patients in the jail? Sometime you should go. You will enjoy how meeting celebrities. Celebrity murderer means he did 20 people, he chopped off the head in the village. You will ask him, are you feeling anything bad that you killed 20? My target was 100, doctor. 20 only died. Before only I was caught. Then you will feel like quickly leaving the prison cell. He doesn't have any guilt that he did it. Right? And another guy who killed his wife suspecting that she has got an illicit relation with someone, you talk to him, he says that I would have not killed the doctor, actually I unnecessarily suspected and killed Sati Savitri like wife. So he still has that guilt and a conflict, internal conflict. So accordingly, obsessions can be both egosyncratic or dystonic. So there are two types of disorders: obsessive compulsive disorder, obsessive compulsive personality disorder. Personality disorder is egosyncratic. They don't have any guilt. What is meant by personality disorder? A disorder that comes with your birth. From childhood you are a very mad fellow, means everybody recognizes you mad and you enjoy to be mad. That is a personality disorder. What is schizophrenic? You are good all the time, suddenly you became mad. That is not personality disorder. So whenever obsessive compulsion is a part of the personality disorder, it is egosyncratic. If the obsessive compulsive disorder as such it is there, that is ego dystonic, because they get anxiety every time obsession comes. So that's the point. I think answer would have been option A. Now, which is a glucogenic amino acid, another supermarket list you have to remember. So alanine, asparagine, aspartate, PB Hilt malt. No, not PB Hilt malt. Alanine, asparagine, aspartate, cysteine, all this. Only lysine, leucine are ketogenic. Only remember those two better. Glucagon acts on what? Glucagon is a hormone. Hormone acts on a hormonal sensitive lipase. What is the big deal? But there is another thing called glucagon-like peptide which acts on gastric lipase. So I think answer should be A, more reasonable answer. Perioperatively, what is a very common cause of drug reactions that the patient will have? Yeah. Typically, most common cause of anaphylaxis are all neuromuscular blocking agents that we give as muscle relaxants are responsible. Where is the rhythm control center of our respiration? It is the pre-Botzinger's complex located in the upper end of the medulla, which is the one which basically generates, it's called the pacemaker of our breathing. You have seen that movie Oopiri. What was the English version of it? Yeah, English version I have seen, good one. Then vasomotor reversal of Dale means what? Typically, there are alpha receptors, beta receptors, doctor. Adrenaline, if you infuse, it acts on both alpha and also beta. Typically, alpha receptor stimulation will lead to vasoconstriction. Beta receptor stimulation lead to vasodilatation. So whenever you infuse adrenaline, you expect what kind of phenomena? The vasoconstrictive ability is supposed to dominate over that of the dilatory ability, and the BP is supposed to shoot. But if you give phentolamine like agent, which is predominantly a alpha blocker, then adrenaline will have an unopposed action on beta, and that lead to significant vasodilation, and that lead to fall of BP. So adrenaline plus phentolamine will lead to fall of BP, adrenaline alone lead to rise of BP, and this is called the Dale's phenomena, reversal phenomena of Dale, and that is because of the adrenaline's unopposed action on the beta receptors leading to significant vasodilatation is what you have to basically remember. A patient is receiving external beam radiotherapy, and typically there is which is most radiosensitive of all. Ovary obviously is most radiosensitive because it has a proliferating cells. Ultrasound picture was given and asked to identify. Anencephaly looks like this. Omphalocele with a protruding gut looks like this. Myelomeningocele typically looks like this. I don't know what was given in actual exam. What was given? An anencephaly. Omphacele was given. Okay. Multiple cysts in the ovary. Snowstorm appearance was given in the exam in ultrasound, that is typically Hyridiform mole. A bamboo spine was given in the radiograph, which is typically seen in ankylosing spondylitis. It is also called Drager's sign. What is Drager's sign? Typically that fused thing, all the anterior longitudinal ligament looks very like a dense line ossification of the supraspinous and anterior longitudinal ligament, which is an obligate intercellular organism. Only two organisms, Rickettsia, Chlamydia, are called obligate intercellular. They can't live outside the cell. Malaria in blood transfusion, beautiful question, is because of what? Mosquito borne blood transfusion malaria. What are the differences? Jayaram Panikar. Still people are reading parasitology book. Parasitology, mycology, virology, we don't read and pass MBBS microbiology. I think there is a truth even today. We only read streptococcus, staphylococci and little bit of botany, zoology knowledge, with which we pass exam. So, sporozoite is infective stage in mosquito borne, trophozoite in blood transfusion. Then hypnozoites are absent in blood transfusion. More complications in blood transfusion malaria. Relapses do not occur in blood transfusion malaria. So that's the point to be appreciated. A parasitic egg was given with polar flux like this. Trichuris trichura. Once more, are you ready with that list? Which will float in saline, which will sink in saline. Accordingly, our seat also will sink or float. Which are bile stained, which are not bile stained. Oh, parasitology, no choice, you have to read. Double bleb sign, where do you see? Fundamentally, what is a double bleb sign? If it is the intrauterine gestation, typically you have the transient appearance that can be seen in the gestational sac, which is produced by the yolk sac which is there inside the amniotic cavity. So that is called double bleb. It is not double decidual sign, right? Bleb or bleb only, no. That means it is intrauterine pregnancy caused by the yolk sac inside the amniotic cavity is what need to be remembered. Amenorrhea, normal pubic hair, normal. Amenorrhea, normal breast but no pubic hair should be there. Axillary and pubic hair is absent, no androgen insensitivity. Androgen insensitivity, what is the karyotype of it? XY. They are fundamentally male, but they have a receptor level resistance to the action of testosterone. This reason testis does not descend. It remains inside the inguinal canal. But the testis will produce androgen which converts into estrogen, and any estrogen will create breast. Hence they have a normal breast but no axillary or pubic hair. Karyotypically they are XY but they look like females. That's the point. Soft cervix, 30% effacement, 1 cm dilatation, Bishop score. One Apgar score, one Bishop score, one Ranson score. एक स्कोर वाला क्वेश्चन रहता IPL 2020. So soft cervix means 2. 30% effacement is 0. Soft cervix is 2. Then 1 centimeter dilatation means 1. So 2 plus 0 plus 1 is 3. Right? There are some more questions, doctor, about another 100 I think. We will try to publish the remaining questions and explanations. Generally, immediately after exam is over, next day only we would have discussing is our tradition. But so many new things we are doing nowadays. Sending doctors to home on a Uber model. Click to Clinic is a new company we started, so not getting time really. But still, without discussing AIIMS questions, with a new batch of students and also some old students. So life is not full. So by AIIMS exam, all the blues in your mind about the last failure in state entrance should go away. The forthcoming November only should be visible for you, where the next AIIMS is waiting for you. Positively December, if NEET is there, that will be the final exam. All India is the final exam. Next 4-5 months, nicely read, and nothing stops you from winning. And already you are all brilliant students because you cracked MBBS entrance, which is much more cutthroat, right? So that is a goal. After JIPMER exam is over, next week, next Tuesday, we will have JIPMER question bank review. Okay, thank you very much.